Perfect, Charlotte. We're exciting to see your talk on your use of.
Thank you very much. It's a big pleasure to present you this case I did in Bordeaux a few days before Christmas. So this is the case of a very old man, over 90 years old, but in a very good cognitive and general condition, that was admitted to our hospital for a non-STEMI with acute heart failure. He had a past history of mild aortic stenosis and pacemaker, and echo showed a moderated ejection fraction alteration with some enterohypokinesia. The biomarker were elevated, and he had moderated renal function impairment. So we decided to do an angiography, and as you can see, we found this very tight distal left main stenosis, heavily calcified, bifurcation Medina 111, and a big suspicious of a nodular calcium. So after many discussions, because of this very old age with the patient, his family, and our team, we proposed left main PCI because the prognosis was very, very poor if we didn't do anything, with IVUS guidance and dedicated calcium preparation tool. And I chose the LithiX balloon Hertz contact IVL preparation because with the Hertz contact, as we could see just before, it's hard on calcium and soft on tissue. And for this patient, I thought the tolerance were good, were better probably. And it was a really tricky point because it was the left main with the age, the ejection fraction alterated. And the ratio safety efficacy was that I was wishing was probably the best choice, I thought. And moreover, I needed many therapies because it is a long lesion. There are multiple sites to treat, the left main, the LAD, and the ostium circumflex. And it was probably very deep calcium and nodular. So the setup was very classical with a 7 French left radial, EBU 3.5, and 2 workhorse guide wires in the LAD and circumflex. As we could just see, there is 4 steps as a quite standard angioplasty that I will show you. The first one here was to predilate with a 2.0 non-compliant balloon, predilation on the different sides. And then I did an intracoronary imaging with IVUS, as you can see, to assess the anatomy of the calcium. And we can see it's a very long lesion with very tight stenosis on the left main, but also on the mid-LAD, with some parts very circumferential calcium, and on the distal left main, a nodular calcium. So then it was easy to bring the LithiX balloon, and I did it in every side. On the left main, it was a 3.5. With the hemispheres, it's 3.9 millimeter. And you can see at the beginning on the mid-LAD with the X-ray enhancement, some footprints. In total, I did 19 inflations. I could do very short inflations in the left mains to make sure the tolerance were good. I put it back in the launcher to make some breaks. And it was really easy to cross it again and to cross it, to bring it also in the ostium circumflex. And progressively, you can see the good expansion of the balloon. Here is the IVUS after the LithiX preparation. And you can see, as we saw, wide fractures, very deep fractures on the mid-LAD and also in the distal left main. And then, as recommended, it's nice to make a post-dilatation with non-compliant balloon to go deeper after make the fracture good. So on the left main, the LAD and the ostium circumflex. And then it's a classical angioplasty with I could bring very easily the first stent, 48 millimeter, from the left main to the LAD, the pot and the second stent on the mid LAD. And I chose to treat the ostium circumflex with a drug-coating balloon strategy for the final kissing balloon to make it as simple as possible in this very old patient. So you can see here the angiographic results. That was very satisfying. Also, the IVUS assessment after PCI, and you can see good expansion even on the distal left main nodular parts and the good appositions of the struts. So here is the checklist at the end. It's not that much at any left main angioplasty. It was only 19 milliliters contrast volume and 22 minutes of fluoroscopy time. And the patient is now at home and is in a very good state 1 month later. So in this case, the LithiX HC-IVL showed an excellent ratio safety efficacy. It was really easy to use, and I could do many inflations. That was really interesting in this long lesion. And we can see it could treat every type of calcium, even nodular, when sometimes it's necessary to do hybrid strategies. It was not in this case. So many thanks for sharing this case and your attention.
Thank you very much, Charlotte, for this great case and this great demonstration how LithiX can be helpful in such a challenging case. And I would say, and I'm curious to know what the others think, that you nicely showed how easy calcium modification can be with this device and how safe, obviously, treating the patient in the left main. So my question would be, do you think if you would have used another tool for calcium modification, the outcome might have been different? What are your thoughts on this?
Yes, I wanted to. It was a tricky case because of the age of the patients and the location of the left main. So I wanted to choose the safest one, and I thought this choice could be the good one because that's true that the safety on the first case, you can see on the pinnacle, is very good. And what was interesting also is that even if it's recommended to do long inflation, 1 atmosphere by second, you can adapt to every patient. And in this case, I wanted to do short inflations in the left main, and it was even with this strategy efficacious.